My name's Sam Lonnan. I was the infection prevention and control team lead before I then moved into the role of decontamination lead. It was very early in 2020. It was towards the end of March, so within the first 3 months. I think it was probably about the 23rd of March. I was actually in the control room and I didn't feel particularly well, but I didn't feel unwell, I just didn't feel quite right. And one of the people there said, "Oh, Sam, you don't look very well at all. Are you okay?" And it was as sudden as that, really. One moment I was feeling fine. I think it was probably about 1:30, 2 o'clock in the afternoon. And somebody took my temperature and it was 39.5 or something, which obviously is very high, and said, "Right, you need to go now, this moment." So I quickly left, drove home. Again, I didn't feel particularly unwell. There was no cough, no cold, no signs or symptoms. But unfortunately, instead of getting better, I became progressively more unwell. And so unwell that I did end up calling 111, and then they sent an ambulance out to me. They treated it very seriously indeed. I hadn't really had anything to eat or drink for probably about 36 hours at that point. I wasn't able to eat. I just had no appetite whatsoever, even though I knew I should do. I just could not bring myself to. And hours and days just sort of slipped by. They hydrated, they gave me a bag of saline, they gave me painkillers because I was in significant pain. They gave me IV paracetamol and then sent me home again. The same thing happened again. They gave me painkillers, they gave me fluids, they gave me an antiemetic because I was being violently sick every time I tried to drink something, and gave me IV paracetamol and sent me home. I felt much better for about 5 or 6 hours, but then it was a rapid descent into being terribly unwell again. This time I think I lasted about 18 hours, and this time they did whisk me back in, kept me back in, and that was in Worcestershire Royal, where I was admitted to the COVID ward, where everybody was wearing ski goggles because they simply couldn't get goggles, masks of every shape and description, typically industrial masks with the 2 big filters on either side, and gowns from theatre so that they were being reprocessed rather than just binned, because it's all that they could have. They'd run out of long sleeve plastic gowns. And there I remained for 8 days. Thankfully, I got better, which was a good thing, a huge relief. And slowly but surely, I began to get well. I got back to work for a phased return. It was a 1 day a week, and then it was 2 days a week. And each time I came into work a week later, I thought to myself, what on earth was I thinking coming back to work last week? I was in no fit state whatsoever to be here. And I felt like that for probably 6 or 8 weeks. Each time I'd look back on the week previously and think to myself, I shouldn't have been here, really. I should have been getting well again. Although I did see that return to work as an aid to my getting better, because I had to think about things other than just sitting at home. And I had to do things that I wouldn't normally have done. So I do feel that helped. I would say about 6 months into my return, so I was back to my usual working hours. Something occurred. My line manager took me into the office and said, "Sam, you've given some advice on this issue," and I had no recollection of it whatsoever. I was then given some time off whilst working well, assessed whether or not I should continue in that role or require some support. So I had probably about 3 or 4 weeks of waiting for an interview with Working Well. During that time, you rack your brains thinking, did I give that information? Didn't I? And start doubting everything that you do. And I can entirely understand why I was put on this sort of hiatus of working, because the last thing you want to do is have somebody who's giving out the wrong advice, especially for something as critical as COVID was then. Things began to calm down COVID-wise. It was after that massive peak, and then we trailed off. Precautions and so forth were still in place. The infection control team were busier than they'd ever been. And I went through the working well process where I had a number of interviews with one of their consultants.
Yeah.
I had bloods taken at my GP surgery, and they found out that my folic acid was virtually non-existent. So I was prescribed a high dose of folic acid. So I came back and I sort of limped along. Brain fog is a difficult thing to really describe. I'm sure I have suffered with it from time to time, but you almost convince, well, and this is probably one of the issues for me, is that I convince myself that it's simply forgetfulness. When I wake up and I ache all over, I just think it'll be all right. I'll walk it off. I'll be fine. And if you're feeling particularly rotten, or one of those bizarre days where you do suddenly find yourself out of breath, I won't assign it to long COVID, which I do understand is self-denial. And my wife always says to me, it doesn't matter what's wrong, you will always say, things are good, you know, that they're fine. And you will battle on believing that they will get better, rather than admitting that there is something that isn't quite right. I do know it exists. I don't doubt for a second that I've seen varying presentations of it since I've come back to work, not only in work, but with people I know. But I'm determined not to admit to it, even though I know that it's something. So it's a funny position to be in, this interview, discussing long COVID, but at the same time convincing myself that I don't suffer with it, or trying to perpetually convince myself I don't suffer with it. I found that the role of in the infection control team, I couldn't keep up. My line manager moved me sideways into a role where I was literally on my own, and that was decontamination lead. Now, there was a certain amount of relief when that role was given to me, but that was tempered by the fact that I used to feel that I did a good job. I did think to myself, oh, I've been put out to pasture. He's getting on a bit now, etc. But very, very quickly, I realized that there was a huge amount of work to do that was just as important as the infection control team. And I was able to utilize my expertise that I've built up over the years in infection control to do that job. The self-denial kicks in every now and again. I'm not able to walk as far as I used to. I certainly can't run anymore. I did try the couch potato to 5K, but literally the length of a football pitch, and that was it. I was on my back, breathing. It felt like I was coughing up blood. So I have tried to improve that. I think I make excuses. If it depends how the week's gone. If I've done a lot of physical things, then I come the weekend, my wife says, oh, let's go for a long walk. I will steer it towards, let's go for a walk, let's make it a shorter one. So I'll make excuses like, oh, how about so-and-so would, or how about so-and-so walk? And rather than say, you know, I really don't think I'm going to make that 5-mile walk, let's try a 2-mile walk instead. I've got the step tracker on my phone, and that's almost for me really, because sometimes when I do get to the end of the week and I don't feel I can do it, I look back over the previous 5 days and see how much I have done. And invariably there's been a day in there that I've done 15 or 16,000 steps, and I think, well, that's why I'm in the state I'm in now. So it's not necessarily, I keep trying to improve, but you just feel that you can only get so far. I don't know if this will be a recurrent theme, but you feel you can only reach a certain level, and that's the best you can get to before it then begins to recede. And then you push like mad and work like Billy O, and you get to that certain level again. And it almost seems like this ceiling you can't get through. Yeah. And maybe that's my definition of long COVID. I can only get to being so well. And as I say, it's through maneuvering that I manage. I suppose it's an an acceptance to a certain degree. I'll always try to do as well as I can. And this is sort of it just in personal life. But sometimes you just can't. But and something I've learned is perhaps rather than keep pushing and failing at something, I will gauge the level of success I know I can get to. Gone are the days when I'd keep going and it didn't matter. Okay, you might have a line the following day or might feel a little bit achy, but now it's managing what you're doing and what you're expecting yourself to be able to do. Yeah. So yeah, that's probably the new me. Two line managers have been very, very good indeed, very understanding and supportive. GPs have been good, and I think it's because they've been. You sometimes hear that a patient will go and say, "Oh, I've got a terrible cold, a terrible headache. You must give me antibiotics," and GPs capitulate. Whilst the GPs that I've spoken to have said, "No, I don't think that's the best way to go about it. You're just delaying something that's going to come up in future. This is what we're going to do." And I've really appreciated that forthrightness rather than them, as I say, just agreeing all the way and giving me exactly what I want. Being a dad of two boys and a girl, a 23-year-old, a 20-year-old, and a 14-year-old, I'm sure there comes a point, and I can almost remember it myself, whereby you realise when you're younger that your dad isn't going to be able to do the things that you can do. And I can recall that with my own dad. And so I think COVID accelerated that because I used to kick a ball around, go on a jog or whatever with my sons. And of course, they would struggle to keep up with me. And they now know that I wouldn't be able to do that with them. So that transition, I feel, has come a little bit earlier than it maybe would have done if it wasn't for COVID. So I think if they see me do something slightly athletic, they're somewhat surprised. They go, "Oh, wow, Dad, steady." So I feel that's happened. And they realise it. You know, they'll come in and give me a hug and say, "Hey, how are you, Dad? You know, are you all right?" Remembering clearly everything that's happened since that point. Yeah. And beforehand they wouldn't have done that, but it may well just be an age thing. I suppose it's something that has not been particularly helpful because there is always in the back of your mind about brain fog. Have I done what I said I was going to do? And I do get asked quite a lot things to do things that I feel I've already done. And I immediately doubt myself and think, uh-oh, this is going to be one of those bad weeks. I'm sliding back. When's it going to get better? And it's only when I go back and check, send emails or notes that I put into System 1 or whatever it might be that I think, oh no, I did do that. But it's having the confidence to be able to say, yeah, I sent that email. Yeah, I made that, I changed the records. Yeah, I've completed that Datex. Yeah, I've updated the risk assessment. When you first hear that, oh, I haven't had that email from you, you think, oh, heavens above, I'm absolutely convinced I sent it. And you immediately think, I haven't sent it. I'm going to have to do that and apologize. And then you do a quick check to make sure that you did. And you think, oh, thank heavens for that. I did do it. And I think that has a harder effect on you. It's not just a matter of, yeah, I sent it, check your inbox. Because you feel that person is right and you're wrong. And so confidence has been knocked in that respect. Because I would say 99.9 times out of 10 or out of 100, you have done what you thought you'd done. But when it's questions, you don't have the confidence to believe that you did do it any longer. In many respects, I feel that you're also having to perpetually prove yourself. You can't just, you need almost 3 points of reference that you have done that job. So treat people who've got long COVID as you normally would do. but and give them the benefit of the doubt. Would be my way of doing it, or saying that to be supportive. I don't feel I need any sort of compensation physically. Thankfully, it's not too a demanding job. Yeah, you've got to be in 2 places at once, and got to be at meetings 5 minutes before you arrive. But that's okay. It's more the mental side of things, and as I say, maybe just the benefit of the doubt, and investigate a little further before you go to that person, because it may just be me, but other long COVID sufferers may well be a little hypersensitive with regard to having done what they said they were going to do, because I'm sure they really have, but people asking us, have we really, makes us doubt that we really did it.